How do you feel as the dad? You must be angry. This is your baby.
Oh, it's shocking. We just became aware of all this in June. Bridget stumbled upon Vax, and on my birthday, actually, she found out that the movie was still playing up in Teaneck, and we drove 2 hours or 2.5 hours from here up to see it, and we walked out like shell-shocked. It was, didn't know what we just watched, and she started putting all this together, and I'm listening to what she's saying, and obviously it affected Bridget more than me, but I think it's just a difference in our
demeanor.
Yeah.
I'm a
But
mom.
I listen, and I'm right on board with them, and I'm not happy about any of this. And the doctors treat you like you don't know what you're talking about anymore. Like with our younger daughter, I still remember when we took her in for her vaccines, and the nurse pinched her fat leg and said, "Ooh, we can get them all in this leg."
I'm Bridget.
I'm Carly.
Mike.
And you have 2 stories.
Yes, I do. My youngest daughter will be out in a little bit.
Okay, let's go.
We'll start with Carly. Well, actually, first I want to tell you this that I found out when I was collecting my doctor's notes. I, for some reason, I wanted to get my reports from when I was pregnant with my youngest because I got a flu shot when I was pregnant with her. And I just wanted to see what trimester they gave it to me, but I stumbled upon this. I had actually 2 miscarriages before I had her, and one of them I had to have a D&E. And this says that the baby that I lost had the MTHFR, a mutation. So I was kind of, when I found it.
As I say here, this patient's sample was analysed for the MTHFR mutations.
So from what people are telling me, because of that, we're going to get tested to see if I have it, and both of my girls had it. But I just wanted to tell you that piece first. And then I need Carly's.
When you say you lost 2 babies, did you have the flu shot with each one?
No. The only flu shot I had was when I was pregnant with my youngest, and they told me that I needed it because I had just had 2 miscarriages.
Oh wow, so you need the flu shot because you had 2 miscarriages.
Yes.
Makes sense.
But before that, before I was pregnant, maybe about a year or 2 before, I had just had a DTaP vaccine. Because I worked in a hair salon and I got glue in my eye. I was a nail technician, and so I went to get the glue out of my eye, and they gave me a DTaP. So I don't know if that had anything to do with it, because what I'm finding out with my girls is the DTaP definitely was one of the ones that affected them.
All right, so let's. Whose story we're going to?
And we're going to tell Carly. She's my oldest.
Carly, how old are you?
I'm 20.
I'm 20. Okay.
This notebook. It's the easiest way because I
This?
took notes. Yeah. Carly's story. That's all Carly's records. It's
Those
just
are all Carly's records.
insane the amount of records she has. I took notes because it's the easiest to do instead of going through them all. But Carly basically, she everything they get in the hospital, and then when she pretty hard delivery, and then when we went to see the doctor for the first time, they said she had thrush and colic. And I'm sure she got the hepatitis vaccine in the hospital because I did everything they told me to do. 3.5 weeks later, she still had the thrush and colic. And then now 9/7/96, she was born 7/27/96. She had hepatitis number 2. And then 10/12/96, she had DPT, OPV, and HIP, and I said that she was congested when I took her in. They instructed me to give her Tylenol. I actually used to give it to her before I took her in because they used to tell me to, and she's my one with the high fevers. She got extremely high fevers all the time. I had a piggyback, Tylenol and Motrin, around the clock, and that was all the time.
I would be in high school and I would still get fevers.
She would still get the fevers
I
like
had
that.
fevers, and none of my friends got fevers when they were sick.
Yeah.
Happened for a long time.
And then she got, at 12/14/96, she got the DPT again, the OPV, and the HIB. And then 12/24/96, which isn't long after, 10 days, she had the green diarrhea. They told me to do the Bratz diet. And then 3/1/97, they gave her DPT again, OPV, and HIB. And then 3/29/97, they gave her Hep B number 3. So 4 days later after that, she's a temperature, congestion, and upper respiratory infection. And then 32 days after she got this is also 32 days after she got the DTP, the OPV, and the Hib. So 14 days after that, congestion. They said it for 2 weeks now. Antibiotics again. Congestion again. 5/1. I'm back in again. Antibiotics. I took her to the ER. Actually, it's in the notes. I took her to the ER. She was 102.4, which wasn't even that high compared to what her fevers used to be. And then 7/10/97, she's cold and congestion again, times weeks. It just says X times weeks. Now she starts with upper respiratory infection. So she's on antibiotics. So 7/11/97, she has a rash now. And they said it's dermatitis. And it actually says in the doctor's notes, the infant has developed a rash over the test site. I guess that's where they gave her the vaccine.
For the TB test.
Mm-hmm. And so now she's a year old, 7/27/97. She had her 4th DPT Hib. And then not even a month later, I have her back, and I'm saying she's got congestion, and she still has a upper respiratory infection, and she's on more antibiotics. Then 10/1/97, she had PPD, whatever that is. I don't know what that is.
PBD.
PPD. I don't know.
Could be sloppy writing in the doctor's behalf.
My-
Yeah, I
if
was
anyone-
trying to decipher the doctor's
My
name.
periscope people might know what it is.
That's what I was thinking.
Is that what it is?
TB test.
Okay. And then 10/21, cold, congestion, and upper respiratory infection, and more antibiotics.
And how old are we now at this age?
Year and a half.
No, year and 3 months. 12/11/97, now she has the diaper rash. A horrific diaper rash. Steroid cream after steroid cream after steroid cream, and we could not get it to go away. We actually finally got it to go away with all natural cornstarch. Thank God. And then he wrote in here that she's eaten a little better because she started having some eating issues. So then at 12/11/97, she had the diaper rash, and they gave her the MMR. And then 12/16, she has a rash again. They said dermatitis. So 12/30/97, she's got a diaper rash again. She's congested. She's coughing. And now they're referring me to a specialist. I think that was for your feet turning in. Your one foot was turning in a little bit. And then I took her back in, and they said that the itching is no better, and she had a rash on her stomach and her legs. And they think it was dermatitis. And now they refer me to a dermatologist. So 4/16, now remember the MMR was 12/11. And 12/16/98, she has the fever, the diarrhea, and she's on antibiotics again. 8/3/98, she's got the fever again. They just said she was teething, and they put her on another antibiotic. Actually, it was 8/18/98 that we were taking her in referral to get your foot
So
checked.
she's 2 years older.
Yeah, you're 2
So
there.
2 years old, she's been at the doctor every other month.
She was not. She was.
For
She never went
congestion.
away. No, it was upper respiratory congestion, but then there were upper respiratory infections, upper respiratory infection, upper respiratory infection, which later turned into asthma. So, 11/10/98, cold, congestion, upper respiratory infection. 12/18/98, rash on arm. That may have been ringworm though from tumbling. 5/11/99, she cold, congestion, upper respiratory infection again. Now she's seeking a referral for her right eye because her right eye droops a little bit. Is it your right eye, right? It's your left eye, right eye.
It's my left eye.
Left
but
eye.
I wasn't gonna
That's
correct
all
you.
7/23/99. She's almost 3 years old here. She's got a fever again. She's got ear pain. She's upper respiratory infection, tonsillitis. She's more antibiotics. 10/11/99, cough, congestion, upper respiratory infection again. 11/4/99, pain in her left ear, more antibiotics. 11/16/99, she's having more issues with the diaper rash. 12/9/99, she has diarrhea and vomiting and antibiotics again. 12/16/99, she's got cough and cold and upper respiratory infection. 12/21/99, she's got coughing, ear pain, upper respiratory infection, and she's on antibiotics. And now they're sending her for a chest X-ray. So I believe this is the first time she had pneumonia, because she had pneumonia a few times when she was little.
So you take a child like you, and a mother like you that wants the best for your child.
Yeah.
You in to get all your immunisations, and you've got a child that's never been sicker. You take a child that's completely unvaccinated, and they're never in a doctor's office.
I know.
It's sick. What is
It
happening?
is.
It's disgusting how much they put into you and everything they put into you. I'm amazed you survived. Listening to the stories that we listen to.
That's it goes on. I mean, I only went. She's 20 years old. I only went until she was 6 years old, and I was just like, she was sick non-stop.
And I remember like being in school and it being hard to concentrate, and all the other kids, why are you always so sick? Like I remember I was always the sick kid. All my pictures, I looked pale. Like my nose was always running as a kid. I was always coughing. Yeah,
That's
constantly
what was about to
strep
come up.
throat. Oh my god.
Okay, onwards.
Okay. So she had referral to allergist, and they also write in the notes that they were looking. They didn't tell me. They were checking into juvenile rheumatoid arthritis, but nobody told me that. They sent me for a referral to an allergist. Both of my girls are allergic to wheat, soy, and eggs. 3/13/2000, so she's 4 years old now. She's congestion, cough, and upper respiratory infection. 4/3/2000, fever times 2 days, vomiting, sore throat, abdominal pain, rash, and antibiotic. 6/10/2000, nasal congestion, cough, sore throat, chronic coughing, and on antibiotics. Now, at 4 years old, I found in her doctor's notes she was completely depleted of vitamin D. We just found out recently she's now seeing, my doctor, and he just found out in her blood work, but she's been depleted through the doctor's records. I have the medical lab work since she was 4 years old. Her number was a 4, is what she was, and Sheila told me she should be like a 50. And you can talk about your B problems.
I have pernicious anemia, which is a vitamin B12 deficiency. It's really rare in pretty much, anybody my age.
Usually
And normally
senior
it's-
citizens
yeah.
look at it.
I get B12. I was getting B12 shots. I didn't know that my arm started to go. It got like a dead arm after, so I stopped getting those.
Well, there's a reason for that.
Yeah.
I was talking to my doctor and asking him to order some lab work and some tests that I wanted her to get done, and I was just telling him that I believe the aluminum, is one of the things that my children have a problem with, that was in the vaccines. And we were talking about her because she was coming home to visit me, and I said I want to get her in for a B12 shot, and he went, okay, and he goes, wait. And he went over and got the vial and came over to me. He goes, read this. There's aluminum in the B12 shot. And I asked him for, the water-soluble one that's easy, to go through your system. And he's like, yes, that's what I use. So I said, well, she can't get them anymore. And he's like, but she needs them. I said, but last time you gave her a B12 shot, you tested her blood 2 days later, and it didn't do anything.
It didn't.
She was
I was
still
under. I still didn't have normal B12 levels. I take supplements every day. I just started a new one, a higher dose, to try and get B12, but it's just...
Do you have a good doctor now? Because I'm feeling like you've just gone through a whole run of really bad doctors.
My doctor that I see is a good doctor. However, he's not updated on any of this stuff, but he's willing to learn. The pediatricians that I saw were horrible. The one that I see now for my youngest, I see one doctor there, and she's okay with me, but some of the other ones in that practice aren't. Some of the ones that I've seen in the past, I'm not happy with them at all, because when I did not, well, that's Cammie's story, but...
All right, let's talk about, so, do you have more on...
Oh, if you want, it's up to you. I mean, we don't have to go through everything. I can just sum it up. But basically, so she had pneumonia twice. I told you all these upper respiratory infections, then pneumonia, then it was asthma. She has the asthma now. When she was older, mono, which I'm pretty sure.
I was young when I got mono.
Yeah, we gotta still check to see if that was around the vaccine time, though. She never did have psoriasis or eczema. She would get these rashes and they would go away. But once she went in, and I continued to vaccinate her because I thought she could handle them. Once she went in for her 14-year-old
I
shots,
was 14.
and it's
Was
in the
it
nose.
Yep,
It was hep and I think meningitis. She got psoriasis on 3/4
So
of
the
her
last
scalp.
jab you had, you were age 14.
I was 14, yeah.
Did you have the Gardasil?
No,
Thank God.
I said no to that.
God.
I was lucky enough. My youngest daughter's OT told me not to get it, and I just told them I wanted to wait until there was more research on it. And you wouldn't believe what they put us through with that.
Oh,
and
God.
I truly, honestly believe in my heart that if she had gotten that, she would not be okay right now. She would not. I mean, she has some health issues, but she is typically developing, and she's a good kid. She's got her head on straight. But if she had gotten that, I don't know if she would have lived. As sick as like going through these notes now and seeing how sick she was constantly, and her fevers that she got. I mean, she would go up to 105.4 fevers, and I give her Tylenol and Motrin around the clock, piggybacking them, and it wouldn't take it down. It
Tell
would.
her about your serum-like sickness.
Yeah.
She got serum-like sickness, and you can tell them. You were like 3. You remember?
I remember it was like, it kind of felt like pins and needles in like my hands and legs, and I just kept saying like my arms and legs were asleep, and like being a kid, you sit on your feet, they fall asleep, but it didn't go away, and it was like they started to get really painful to just move my limbs, and it was I just couldn't move them. It was as if they were stuck. They were stuck. I couldn't move them. It was as if they were really, really bad pins and needles, really, really.
And
asleep.
she had a rash all
And
over.
It hurt so bad to move them. I was 3. I mean, that's pretty much all I remember.
Yeah,
Just not being able to move.
and we took her to the hospital, and they quarantined us because they thought that she had the measles or something. And I kept saying, I don't understand why you're quarantining us because she's vaccinated. Like, this is so silly. Like, why are you quarantining us? And then they wound up sending me home, and they really didn't tell me anything.
We were also saying when I was 14, when I got Hep A, I never had eczema, I never had psoriasis or anything, but within a month and a half after getting that, 3/4 of my scalp
That's what I said.
had completely covered by psoriasis.
Yeah, I mean,
have you got rid of that?
for the most part.
Sometimes, I mean, I still have some patches.
But not like it
But
was.
yeah, it's not as bad.
And how are you doing today? How is your health?
I'm okay. I definitely feel the effects of the B12 deficiency, being in a fog sometimes, memory loss, like the stuff that goes with that. I definitely.
Your extreme fatigue.
Yeah.
You want to have B12 or you don't?
But because she doesn't.
So you're not having the vaccines though anymore? Right.
No, it's like my body can't hold on to B12.
She also has a vitamin D deficiency. I told you we found out about when she was 4, but we didn't treat it up until a year ago because nobody told me.
I didn't know.
How many children have you guys got?
2.
You got 2.
And even when
And both injured.
Mm-hmm.
Wow.
I did not know that she was injured until I found Vaxxed. And when I would listen to the periscopes, like he was vacuuming the pool, I would walk around with my earphones on, so my youngest couldn't hear carrying my phone as I'm cleaning. I was like, why do I hear both of my children in these stories? Like, I would never describe, like, autism as, anything that she's going on, but then I started realizing that it's vaccine injury.
About vaccine injury.
And I'd be on Periscope shouting out, like, what do you mean about vitamin D? What do you mean about vitamin B? And it's now...
This is exactly what they wanted us to. They didn't want you to ever know about it. They wanted it to be about autism. They wanted the autism vaccine fight to go on to distract you.
Yeah.
And the great many that we're coming across now, most of our stories are about vaccine injury, but not autism.
I know.
I would say, wouldn't you
Yeah.
Now it is huge, and this must be killing them. That you guys are all working out what happened to your kid.
Oh, I'm sure, yeah. We're being heard.
And when you said, like, they don't treat you nice when you refuse vaccines.
Mm.
Like when I was old enough to say,
but when
no,
you denied
I don't.
Gardasil.
Yeah, I don't. I mean, it was within the past year. I was like, I don't want to get the Gardasil. Like, I'll take my chances. And they're not nice.
No.
How can you go into a doctor's office with a child who's on the autism spectrum and they keep giving them DTaP, and then you find out that the paperwork inside that they don't show you actually lists autism as a side effect, but the doctors keep giving it to them and giving it to them. Like, that just tells me that they're not reading the inserts.
They're definitely not reading the inserts, and also, I don't know if you know this, but you can't sue them, so they can do whatever.
Yeah, I
they
know.
want.
Right.
Yeah, I
They're
know.
not scared.
Yeah.
And you can't sue Merck. You can't. You're on your own.
Right.
And that's why they don't care. The minute we can sue them again, which will happen, this will stop.
Well, they seem to want to mandate us into vaccinating all our kids. I think they need to mandate these pharmaceutical companies into not having such an influence over politics. You know, there needs to be some separation. They're trying to force it all on us.
These are Carly's shot records if you want to see them.
You want to see that?
I have another one too.
Crazy.
So many.
That's Carly.
There's so many.
I know.
I never.
Let's start hammering.
Cam?
And I can tell you about Cammie, and I'll show you Cammie's shot record. While I have it out.
So Carol's Cammie,
Cammie's 10.
and Cammie has a diagnosis.
Cammie has autism.
Right.
Yes.
I mean, we've met her. This is Cammie. So tell us the story behind all this.
Well, like I told you earlier, I got the flu shot when I was pregnant with Cammie. And then in the hospital, I'm assuming they gave her the hepatitis shot and whatever else they give, because I didn't know any better, you know. They did what they did. And then I took her for her first appointment 6 days later, and they said, did she get the hepatitis shot in the hospital? I said, I'm sure. She gets, you know, everything that they're supposed to get. And they said, well, we're just going to give her another one just to make sure. And my husband was with me. And I was like, wait. I didn't know I had to bring hospital records. I didn't need them with my oldest. I'll call and, you know, get it. And she was like, no, that's not going to hurt anything. And then she like gave it to her that quick. And I was just like, okay. And then every other vaccine they gave her that day. And then Cammie, her first shot, Carly had a broken leg. I was at Children's Hospital getting her leg casted. She was with my husband, and she screamed the entire time. Her leg swelled up from like her thigh all the way down to her toes. It was hot to the touch. It was beet red.
And she screamed that high-pitched squeal for hours and hours and hours, and he couldn't do anything to stop it.
Yeah, I actually called my mom because, like I said, I couldn't leave. I was getting her casted. I called my mom to come over. My mom's the second oldest out of 11, and she loves babies, and she can always calm a baby down and everything. And she was like, Bridget, I've never in my life seen a baby act like this, screaming like this, and especially after a vaccine. And my mom said for so many hours of rocking her and everything, she couldn't do anything. So she said, I was so desperate. I actually got some Preparation H a doctor gave me as a sample somewhere, and I put it on her leg, and I guess the coolness calmed down how she was feeling. And then she calmed down, and she fell asleep because she was exhausted from crying so much.
All day, yeah.
It's awful.
And that's the difference in used to. When she got a vaccine, she would sleep all day long, where Cammie would scream for hours upon hours upon hours. It was horrible.
Reactions to her first 2 rounds of shots. The same thing happened on her second round. Her leg swelled up. She screamed for hours. So after that, it was time for her to get her MMR shot, and we had heard the controversy involved in it, so we told the doctor we didn't want to do it at that time. And they basically told us how horrible we are, and well, Bridget was there by herself.
They told me that I should consider myself lucky that other people vaccinate their children to keep my daughter safe. And I was only refusing the MMR, and I was only delaying it. Cammie, I think, had some issues from the beginning because I got the flu shot pregnant, and then she had 2 hepatitis vaccines within 6 days. So she's 6 days old, and she's had 3 vaccines, you know? And so she continued to get all of her vaccines, and she was doing her milestones, but she was just getting them by the date. Like, they would say, well, if she doesn't do it by this day, then we'll be worried. If she doesn't do it by this month, then we'll be worried. And she'd always catch up right on time. She ate for me. She was fine. She was, you know, eating table food.
She'll eat anything.
she was eating good.
And she was so happy. She was, like, most of the
Yeah.
time she was such a happy baby, you know? She was...
Yeah. Well, that was her when she could see she was still, like, she's doing everything. She was baby. She was, like, 9 months old there.
Yep. She would copy me, everything I did.
And now?
Well, now that's a whole other story. But what happened with her was, I didn't do the MMR, and I did still do 2 more rounds of vaccines. I gave her chicken pox, and she got the chicken pox on her leg. And then I stopped everything, and I didn't give her anything else for a while. Cammie was tactile defensive. We had her in a lot of therapies. She couldn't even, like, touch rice. Like, if you would go, you know how the kids play with the rice bins? She would throw up. She's still, to this day, if we're eating dinner, of course she doesn't eat what we eat, but she'll walk out and we'll be eating, and sometimes she'll just randomly throw up. And I'll be like, you're not eating this, it's ours. But she'll just throw up just from looking at it. She has fine motor problems. She has a motor planning delay. Of course, she's tactile defensive, but that's getting better. She wore a compression suit when she was younger. She didn't speak. We used to PEX for a long time. She didn't speak for a long time. I'd say she was close to 5 before she talked at all. She did, when she was little, just have a couple little words. Like I said, she was towards the end of everything, you know, her milestones, but she would get there. But they say she doesn't do it by this month. She didn't walk, though. She skipped walking, and she would knee walk. And at the time, we thought, oh, wow, isn't that so cute? She's so smart. Well, here we found out it's not, because she missed a milestone that she really needs. And I attributed that to her motor planning delay. You know, because she couldn't do, like, the hands and the feet together. Like, now she can't ride a bike. You know, she has mild hypotonia. She does speak now. She doesn't use the PEX anymore. She can't really come home and tell me about her day. It's like trying to get information out of her. But she can tell me her wants and needs, basically. She still has major sensory issues. Clothes are a problem all the time. Buying clothes, I've cut the tags out of everything, and you have to feel the inside of them, make sure they're nice and soft inside, or she won't wear them. What else? She's still in speech. I wish she was still in OT. You know, she goes to special school. She gets a lot of therapies there.
I mean, she doesn't eat any.
Yeah, she eats horribly. She has major constipation issues.
Is she on the gluten-free diet?
We tried that when she was little, and she completely shut down. She didn't eat anything for days, or drink anything. And at that time, I had early intervention coming a couple times a week, OT and speech, and so they were all working on trying to get her to eat. But now you got to remember to ask her if she wanted like to have her try peanut butter. She couldn't even touch peanut butter. She would throw up all over the place. We did hours upon hours upon hours of therapy where she would just touch it, and you would try to get her just to put it to her mouth, you know, just to get a little taste in. So I mean, she's really bad. But we are trying this time, because she shut down when we did the gluten-free, casein-free. This time we're going to try to eliminate and replace things instead of going like cold turkey, because she did shut down and she wouldn't eat anything.
She's a little older now. We think it may be a little easier to try to get her to try things, which is not easy.